I'm Dr. Kenneth Maiese. Our work involves cellular signaling, molecular signaling. We're based from New York, and we're actually very interested in working with special novel targets that actually can affect cell survival and cardiovascular disease, and subsequently translate this into patients. Today we were talking about our work with the mammalian target of rapamycin. This is a very unique pathway that affects many things in the body. It's quite ubiquitous. This pathway affects cell growth, cell survival, and cell senescence, as well as diabetes. In particular, we focus today on targeting this pathway through areas such as Pras40. It's a sub-signal of the mTOR pathway. In addition, we've tied this to the cytokine and growth factor erythropoietin. Erythropoietin is approved by the FDA for the treatment of anemia, and it's very important in cardiovascular disease, but also erythropoietin actually can have some inhibitory effects that may be deleterious during hypertension or even during cancer. In this way, we're looking at some downstream targets that might be relevant to treat cardiovascular disease and to help endothelial function. What we're able to show today is that through this mTOR pathway, by activating it, we can affect certain areas of programmed cell death, and through these areas we can actually affect the sub-signaling pathway of Pras40. Independently, Pras40 actually controls cell survival also in the vascular disease. So it's important that you have a number of pathways to target, and in particular, if we can target even Pras40 in a few years in developing the ability to modulate the Pras40 pathway, this will even take us further from mTOR, because mTOR is actually very vital in many pathways, but it also has a complicated scenario with affecting programmed cell death. In some scenarios, it's important to activate mTOR. In other scenarios and other disorders, it may be important to inhibit mTOR, such as during cancer. So this is very early work. We intend to have this move forward, and we think it's very novel and exciting and very important, since in cardiovascular disease, there are actually very few therapies that are quite effective, and it's usually for a subpopulation of patients. Overall, many therapies that we have today are more symptomatic, although we've been making great progress, of course, with preventive medicine and controlling hypertension and lipids. But overall, we're very focused on developing new strategies and new avenues for cardiovascular disease, and we're very grateful to be able to present today. Well, I think it's not just important for people in cardiology, but multiple disciplines. And I myself, or from actually, even though we do cardiovascular research, we're also from other disciplines that involve the nervous system. And so I think that what the Congress does is bring people together from multiple disciplines. And I think that's one of the exciting things that the Congress is able to do.